discharged from the hospital today.
More breaking developments, in fact, coming in now. The total toll of deaths caused by COVID-19 infection has reached 37. 5 of these deaths have been reported in the past 24 hours itself. Currently, the toll of active COVID-19 infection stands at 4,026 in India. Dr. Ishwar Gilada, infectious disease expert, is with us live. Dr. Gilada, the number of fatalities has risen by 5 in the past 24 hours.
Yeah, this is going to happen when any kind of infection is on the rising. Nevertheless, flu, RSV, mycoplasma, paraflu, and COVID, they have been up and down in last 2.5 years. So currently there is a scene of COVID going up, surge of COVID, and therefore the people with comorbidities dying. And if they have a concomitant finding of COVID being positive, they are labeled as COVID death, and that is wrong way of labeling COVID death. COVID death should be labeled only when somebody has nothing else, has COVID, progressing to the level where requiring oxygen, requiring ICU, requiring ventilator, getting acute respiratory distress syndrome, then dying, and that is called a COVID death. So whatever deaths are notified all over the country, whether in Maharashtra more than 10 deaths or from different states or from Kerala, they are all people with comorbidities, and comorbidities are varied type: cancer patient, patient on chemotherapy, patient on renal failure, uncontrolled diabetes, people with asthma. So all these people already have some problem, and if they get COVID, they can be labeled as COVID positive, but they cannot be labeled as a COVID death. And therefore, we should not be worried. Even if there are some deaths happening, we should prevent those kind of deaths if they are happening. But COVID is not playing any role in hastening the death.
All right. Some respite from Delhi. There have been no new